Ah yes, the classic human pretzel maneuver. You have just converted your ankle ligaments into linguini in less than 1 second flat. Congrats. Today we are diving deep into the organized chaos that is your ankle. Is it a good old anterior talofibular ligament sprain? A syndesmosis surprise? A sparkle of tarsal tunnel sign? Or has your navicular just given up on life? To crack the case, we are heading zone by zone, anterior to laterally. Because if you want to fix it, first you have to learn to blame it properly with their correct names. Dorsiflexion? Yeah, not happening with anterior impingement. If anterior ankle pain had a personality, it would be the passive-aggressive roommate blocking the door to your gait cycle. You have your usual suspects, osteophytes, anterior impingement, and the glorious grind of early osteoarthritis, and of course our passive-aggressive friend, the talocrural joint that refuses to glide. Check that arthrokinetic jank. Is talus not gliding posteriorly? Say goodbye to clean dorsiflexion and hello to tripping on flat ground. Instability and pain on uneven surfaces. Feeling of giving away? Oh great! And welcome in the Chronic Ankle Instability Club, man. In LSA, once you exclude fracture with the Ottawa ankle rule, then it's time to palpate, test strength, include some special test. Welcome to the lateral ankle dream, where foot skills meet disabilities. During the Spain, did you hear a snap sound? Oh man, that's great. Now I have two news for you. You get good earrings, so no auditory check this year. However, you probably fuck up your anterior talofibular ligament, most valuable player of most commonly torn ligament on turf. The anterior talofibular ligament is always the first to go. The calcaneofibular ligament joins the party only if you fuck up more. Like grade 3 level dramatic. Same for the posterior talofibular ligament. Least but not last shit. ATFL, go for an anterior drawer test in maximum loose pack position and pull the shit out of that ankle, checking for laxity moves. Anything over 9 millimeters and we have a winner. Not the kind you want. But hey, don't sweat it. This test has less specificity than a thermometer on an HIV patient. Talar tilt? This shit is for assessing the CFL. Go for it, it has a bit higher spec. So you twisted your ankle outward with some force? Well, congratulations. You've likely graduated from a simple sprain to a fucking syndesmotic injury. In this scenario, functional tests become your best friends. Look for an inability to bear weight or hop, pain during dorsiflexion combined with aversion, and tenderness over the syndesmosis ligaments. The squeeze test? While it boasts a high specificity of around 88%, its sensitivity is relatively low. So, a positive result strongly suggests a syndesmotic injury, but a negative one doesn't rule it out. So always keep the patient history as the fucking king, man. Patients often describe this pain as deeper and more proximal than a typical lateral ankle sprain. Recovery? Expect a longer rehabilitation period, and in some cases, surgical intervention might be necessary. Remember, accurate diagnosis is key to effective treatment. Rehab without addressing kinesiophobia is just rehab with drama. Use questionnaires and proms as clinical measures. Lateral shit sprain? Man, it's always the same damn trio getting caught, like 3 Mexican brothers on the Texas border. The Peroneals. Especially the brevis. That one is always flirting with avulsion fractures. Posterolateral swelling? Could be your retinaculum snapping out, crying for help. Check for tendon subluxation and stop pretending it is just a bruise. Remember, it's time to boil the rice and use the peace and love strategy. Be more physiological.